Hello, welcome to Maniax Orange Channel, hope you enjoy, don't forget to subscribe and like.
Here are 10 facts about diphtheria. 1. Diphtheria is an infectious disease caused by bacteria that usually produce exotoxins that damage human tissue. 2. The initial symptoms of diphtheria are flu-like but worsen to include fever, swallowing problems, hoarseness, enlarged lymph nodes, coughing, and shortness of breath. Some patients may have skin involvement, producing skin ulcers. 3. The cause of diphtheria is an infection by Corynebacterium species. The most severe infections are due to those Corynebacterium strains that produce exotoxins. 4. The highest risk factor for developing diphtheria is not getting immunized against the disease. Other factors include crowding, immunosuppression, and direct or indirect contact with an infected individual. 5. Diphtheria is diagnosed by the patient's history and physical examination. Culture of Corynebacterium from the patient yields a definitive diagnosis, although patient should be treated if diphtheria is even suspected. 6. The treatment of diphtheria involves early administration of antibiotics. The use of antitoxin, made in horses, is done to neutralize Corynebacterium exotoxin that has not bound to human tissue. 7. If treated appropriately and early in the infection, the prognosis for diphtheria is usually good. However, if complications develop, the prognosis decreases, especially if sepsis and/or cardiac involvement occurs. 8. Complications of diphtheria include heart rhythm problems, sepsis, organ damage, and breathing problems that can be severe enough to cause death. 9. It is possible to prevent diphtheria. The main way is to appropriately vaccinate individuals with one of the 4 major vaccine types available. 10. The history of diphtheria dates back to Hippocrates. Once the organisms were identified and found to produce exotoxins, the development of vaccines have markedly reduced diphtheria worldwide.